sounds like.
Good afternoon.
Good afternoon.
I'm Kim McCarl, Communications Officer with Contra Costa Health Services, and Dr. Chris Farnitano is here today to take some of your questions. We thank you for doing that, Dr. Farnitano. In order to maintain a little distance between the doctor and myself, I'm off camera, so you won't see me, but you will hear my voice as I go through these questions. We did get a good number of questions from you, so we're going to do as many from the public. So we'll do as many as we can in the half an hour that we have allotted, and then we'll find another time next week to do it again. So we appreciate you always being willing to do that. We have about 4 categories of questions that we'll go through today. We want to start a little bit with questions around pace of opening. We'll talk a little bit about testing, what activities are allowed, which ones are not, and why not. And then we have kind of a catch-all category at the end. So that's kind of how we'll make our way through this today. So I wanted to start a little bit about some misperception that there might be in the community around what happens on May 31st. So can we talk a little bit about the 2 orders and how they work together and how they don't work together?
Yes, and so the local health orders we started back in middle of March initially had an end date, and that end date was really to kind of signal that we were going to reevaluate those orders on a short-term time period basis. And we have evaluated those after several weeks, and we've made changes to those, and recently we've loosened up some of those restrictions. But some of the public took that end date to think that when the end date came, we'd suddenly open up everything and the order would go away and we'd be back to our kind of pre-COVID life. And that was never the intention. So as with the state order, which does not have an end date, the current local order does not have an end date. Having said that, we're still committed to reevaluating this every few weeks and making sure that we're looking at the data on a daily basis and making adjustments and seeing where we can open up activities as the data and the epidemic allows.
So why are we not reopening as quickly as our neighbors, even though our indicators appear to be better than some of our neighbors?
Well, one thing about pandemics and viruses that spread like this coronavirus or COVID-19, is they tend to spread much more in densely populated areas. They spread from people to people. The virus doesn't have legs. It relies on people to spread them. And we've seen, like in places like New York City and Miami and Chicago, that the denser populated areas are much higher risk for outbreaks and surges of cases to occur. And so rural areas that have low numbers of cases and the population is just much more spread out, there can safely open up things at a faster pace than denser areas like Los Angeles and the Bay Area can.
So attestation, what is that and how does that apply to us versus more rural communities?
So when the state created this attestation process, it really was thinking in terms of 3 different groups of counties. There's the very rural counties with very few or no cases and a very spread out low population density, like in the far, far north of California, that could be allowed to go faster than the state order and the state's plan to reopen. And then there's another group of counties that are going to be opening up at the same pace and on the same schedule as the state. And the third group is these group of more highly populated counties, especially the densely populated counties in the Bay Area like Contra Costa County and the Southern California counties. And those, because they are at higher risk, they have higher numbers, need to move at a slightly slower pace than what the state is to prevent another surge of cases.
So it can sort of feel like we're being penalized because of our proximity to counties with worse indicators. Are we being penalized?
Well, county of Contra Costa is not an island. We don't exist outside of our neighbors. And so many people who live in Contra Costa County work, shop, drive to other counties, drive to Oakland, work in San Francisco. And so what happens to those counties affects Contra Costa County, and what happens in Contra Costa County affects those counties. And that's why the Bay Area health officers have been working together to try to coordinate our efforts so we march at a similar pace in a careful, deliberate reopening of the economy, so that we don't go too quickly and lead to a surge of cases, because no one wants to go back and shut things down again because we've had a surge that is leading to more deaths and our hospitals being overwhelmed.
So are we now in phase 2?
So the state has created these concepts of phases. Phase 1 is where we were with a more strict shelter in place or stay-at-home orders, and then phase 2, phase 3, and then phase 4 is a full opening of our economy. But even with phase 4, things are going to be different. There are things like enhanced hand hygiene with hand washing and hand sanitizer, social distancing, face coverings when you're out in public, a real culture of not going to work when you have the cough or sniffles or any kind of symptoms. Those things will probably be with us even in phase 4. But the state created these steps of phases. So the state moved into early phase 2 on May 9th. Contra Costa County moved into that same level of early phase 2 11 days later. So the state is now moving in deeper into phase 2 over the last few days, but is still not quite into phase 3, where we are evaluating where we are right now, currently in early phase 2, and considering further moves if the numbers and the data suggest we can do that safely.
So in phase 2, what are the minimum requirements that a business must enforce, and what happens if the business doesn't comply?
So there's different requirements for different businesses. All businesses are required to have a social distancing plan, and there's a template for that plan that is part of our health order and is found on our website, cchealth.org//coronavirus. That social distancing plan includes making sure customers can stay 6 feet apart, that employees and customers are wearing face coverings, that there's hand hygiene available, all those kind of steps so that businesses can reduce the risk of being a source of spread of this virus between employees, between customers, and the public.
So we've talked a lot about the 5 indicators, and I know we have a lot of people visit our dashboard on our website to look at the progress we're making towards indicators, but how do those really help you understand criteria for moving into the next phase? How are you using those and the science behind those to make decisions about moving forward?
We in the Bay Area had one of the first in the nation shelter-in-place orders, and that was very effective because of the cooperation of the entire public, all the residents really following this very strict stay-at-home order. We were able to prevent a serious surge. We flattened the curve. We brought the numbers down. Now we have to figure out how we go back to a more normal kind of life with opening up activities, opening up businesses without having a surge, because no one wants to stay in that strict shelter in place forever. So those indicators are telling us that we are opening up carefully and slowly, and we are doing it successfully. So we're not overwhelming our hospitals. We're not seeing a surge in cases. Our hospitals are well prepared for any small surges that do happen with enough personal protective equipment that we can protect those healthcare workers who are on the front lines every day, and we can say to them, we've got your back, and we're not putting you and your families at risk. We've got the equipment that's going to keep you safe. And then we have the infrastructure to really identify new cases, and that's through lots of testing, and by testing we can identify cases so people know to isolate and quarantine. So this is really a targeted shelter in place. We want to target those folks who test positive or are exposed to someone who tested positive, so they can stay at home, stay away from work, stay away from the supermarket or the retail store while they're potentially infectious. And that means a whole team of contact tracers who can reach out to all those people who test positive, identify who their close contacts are, make sure they know what they need to do to stop the spread. So if we can do this kind of targeted shelter in place, we can allow the rest of the economy, the rest of the society to open back up in a safe way.
So this is probably one of the most common questions we get and one of the hardest to answer, and that is, when do we anticipate opening back up?
So when is a really hard question because the virus doesn't operate on any fixed schedule. We really need to look at the data, and we are looking at the data on a daily basis. We know that it can take 2 weeks for someone to get an exposure and then develop symptoms. It can take longer before they come in and get a test, get those test results back. We also know it can take about a week from the time someone first gets symptoms to the time they get sick enough to be in the hospital. So our hospital numbers are really a late indicator. It takes a while before a spread in our population really leads to a change in the hospital numbers. So we've been saying we need several weeks, at least 2 weeks, before we make a big change, before we can safely say it's safe to make another big change and another opening. So on May 4th, we opened up to all construction and all outdoor businesses and a lot of outdoor recreation. And we waited 2 weeks and looked at the data. And after 2 weeks, we saw that our numbers were staying flat, our hospital cases were staying flat. We were making progress on getting enough PPE, although we're still not there yet. We're making progress on getting more tests done and getting more case investigators done, although we're not where we want to be yet. But because of that progress, after 2 weeks, we made another change. We opened up to curbside retail, we opened up to manufacturing, warehousing, and logistics. And so we're going to continue that approach. We're going to be not necessarily going as fast as the state. We're going to let the data drive our changes. And we're going to give a couple weeks between a big change before we make another big change.
Why does quarantining healthy, low-risk people make sense? Shouldn't we just quarantine older adults and people with health conditions?
The problem with quarantining just the high-risk people is those high-risk people can't be 100% quarantined. They can't be completely sealed out from society. For example, someone who lives in an assisted living facility or a nursing home, there are staff there that are bringing them meals. There's staff there that may be doing personal care for them. Those staff have to live in the world. They have to go to the supermarket. They have to do shopping. They're coming home to their family members. So if those folks and their families and the other people they have contact are picking up cases, then they're bringing them, they're exposing them to the elderly. If we have a child who picks up a case at school, we know that most children don't get very severe illness, but that child could bring it to their grandparent, could bring it to their mother or father who has heart failure or who has diabetes or some other chronic condition that puts them at risk. So because we can't seal off the high-risk population from the rest of the population completely, we need everyone to take the steps to reduce the spread to protect all of us.
Dr. Sarah Cody in Santa Clara County expressed concerns about the state moving so fast toward reopening. Do you have similar concerns? Is it problematic for the state and Bay Area to be moving at such different paces?
I do have some concerns at how quickly the state is moving. If you look at the statewide numbers, you can see that the daily cases in California are on the upward trend. Deaths in California are still flat or even trending slightly upward. And hospitalizations across California haven't really dropped very significantly in the last few weeks. You can look at many areas of the state where cases are really spiking. So we in the Bay Area, Dr. Cody, myself, the other health officers in the large counties in the Bay Area are really trying to work together and take a scientific approach, let the data drive the decision making, and not go too quickly before we can see the effect of one change before making another change, because it's going to be a lot harder to pull back than it is to move forward if we go too quickly and we see a big surge in cases. And remember, those surges in cases, not only do they overwhelm the hospitals, but they mean additional unnecessary deaths in our population.
So you talked a little bit about testing, but I want to talk a little more specifically about that topic because I think it's an important one. And frankly, it's one where our community can be part of the solution. So the first question is, should I get tested?
Yes, you should, Kim. And I recommend that everybody get tested. I myself got tested last week and really encourage everyone in our community to get tested. And the reason is we don't know everywhere where this virus is hiding. And we are learning more and more about how asymptomatic individuals are a big driver of spread of this virus. In fact, some studies suggest that the time that people are most contagious is in the 24 hours before they get symptoms. And there's some people who never get symptoms but still spread the virus. And the person they spread it to could potentially get very sick or even die. And so that's why we need everyone to get tested. We were testing about 400 tests a day a couple weeks ago. Now we're testing over 800 tests a day. So we've doubled the amount of testing in 2 weeks, but we want to get up to about 2,200 tests a day. And that's the level we think if we get to that level, we'll be able to really identify most cases of COVID in the community so those people can know to isolate themselves, to separate themselves temporarily until they're no longer infectious, and we can really keep the numbers down to a very low number and continue to open up our society.
Did it hurt when you got tested?
It didn't hurt, but it was uncomfortable. And the test I had was a deep nasal swab, and was performed at one of our test sites that we have open for anyone in the community who wants to get a test site, symptoms or no symptoms. We are actually, a lot of sites are now moving to a more comfortable way of testing. It's not a deep nasal swab, but it's a more superficial nasal swab. It doesn't go as deep in the nose, and it's much more comfortable. And some sites are even allowing the individual to collect their own swab rather than have a nurse or a doctor do the swab. So the test is getting easier to do. It's getting less uncomfortable. But even my test, it was 10 or 15 seconds, a little uncomfortable but not painful, and I was in that testing center and out in 10 minutes, so it was a real quick procedure.
And I would just also say that our call line to schedule your test has a wait of about 6 minutes right now. So there was some problem with hold times when we first started, but that has been resolved. And so we're waiting for people to call and schedule their appointments.
Yeah, and we also, the state test sites have an online where you can schedule them online. I did that, and it took me 10 minutes to create my little username and password and have my pick of different appointment times. So you can do it online. You can call, and very short wait to get an appointment, and we've got appointments available for anyone who wants one.
So somebody in the chat section just asked a very good question, which is how often should somebody get tested?
Well, we are recommending that people who at higher risk get tested on at least a monthly basis. And so who's at higher risk? Well, we think about healthcare workers, first responders like firefighters and police officers. We think about folks who live around or care for the vulnerable elderly, like the nursing home workers, the assisted living facility workers. But we also consider in higher risk categories those folks who are have a lot of contact with the public. So the retail worker, the checker at Safeway, the folks who are working in those essential or allowed businesses who have a lot of contact with the public. Even though you may be covering your face, you may be doing great high-end hygiene, you may be trying to stay 6 feet apart when possible from customers. All those things reduce the risk, but they don't eliminate it. And so we do encourage folks who are in those kind of high contact type of work to really get tested on a regular basis, at least monthly.
So we talked about this a little last time, but let's talk about it again. Antibody testing. Are we doing systemic antibody testing? Are we giving antibody plasma treatment for high risk? Are we recommending antibody testing?
So currently, the main experts in the field, including the Infectious Disease Society of America, which is a leading group of infectious disease physicians, are only recommending antibody testing in the setting of some kind of a research study to look at the prevalence of antibodies across the community, and not for an individual's use, because they're not that accurate yet enough to really tell us for sure whether you have antibodies on an individual person. So, for example, a test that is 95% accurate when it has a positive test sounds really accurate, but when you have a population where there's 5% or less of the population that has actual antibodies, if you run that test around 100 people, you'd actually find that you get about 5 or 10 tests that are positive, and only 5 or 6 of those tests are really actually people who have antibodies, and the other 4 or 5 people are what we would call false positives. The test says they have antibodies, but they actually don't. And so a lot of the tests out there on the market have that level of accuracy, which isn't really enough to tell you, yes, you have antibodies, or no, you don't. We really are waiting for tests that are even more, like 99.9% accurate, to be helpful. And then besides whether knowing whether the test is accurate in telling you if you have antibodies or not, we still don't know what those antibodies mean. Does it mean that you're immune from COVID and you can't get it again? If you are immune, how long does that immunity last? Does it last a month? Does it last a lifetime like measles immunity does? Does it last, a few months like the influenza virus immunity does? We still don't have any of those answers. And so the test shouldn't be used for any kind of decisions about, can I visit my grandmother? Can I be a healthcare worker and not wear a mask? Can I take extra risks because I feel like I'm safe? We can't make any of those judgments in an educated way based on this test, because we just still need to know so much more about what those antibodies really mean. And then there was a second part of your question.
The second part of the question was around systemic antibody testing. Did you?
Yeah, that was, I think it was a question about plasma.
Are we giving antibody plasma treatment?
Yes. So antibody plasma treatment is a research therapy. So it is being studied in some hospitals as a research tool to see, would this be beneficial to give to COVID patients who are sick in the hospital, and basically taking antibodies from people who have recovered from COVID and giving them in an intravenous infusion to people who are sick with COVID. Could those antibodies help fight the virus? And it is being a drug that is being studied, a therapy that is being studied, but there's not enough evidence yet to know whether that really works or not. So the FDA has not approved it as a treatment. It's really a research study that is currently being studied in some research centers.
Great. So we realize this shelter in place is hard for everybody, but it's particularly hard, I think, for young people who sort of live their lives based on their social life and can't always understand why it is that we find ourselves in this position. So I have a list of questions here related to activities, and some of them you've answered time and time again, but I think it's worth answering again because people are still asking, and I think it's important for us to realize that these things are of concern to them. So, when will swimming pools be allowed to open? Why is lap swimming not allowed? Any hope of reprieve for summer activities, especially for kids?
So as the weather's getting warmer, we're getting this question quite a lot. A lot of people want to get back to swimming as a recreational activity or back to their swim team. The state order does not allow swimming at this time. Part of that reason is because even though the water itself, a chlorinated pool helps kill the virus, but people congregate around pools, people breathe above the water in pools, people congregate in changing rooms, and the local order is not allowed to be any looser than the state order. And so until the state moves to the point where they're allowing swimming, the only swimming that really is allowed is in the setting of a daycare or summer camp for children. So we have rules around how to safely operate a daycare setting or a camp with a stable group of 12 children or less, and a lot of activities can happen within those 12. They can be in closer contact even though they're not from the same household. So the contact sports and swimming and other things can happen just in that child care setting, but not for children who aren't in child care or a day camp, and not for adults at this time.
So speaking of these groups of 12 children, summer camps can operate, but can activities like Cub Scout den meetings take place if it's 12 children or less operated in the same way as a camp?
Currently, the order allows for day camps as a part of child care for workers who are, they're an essential business and they're working in their essential business, or another allowed business like an outdoor business, or they're working in their business from home. And so it's really the letter and the intent of the order is for a child care activity. And it's really recommended that these be a stable group, ideally over at least a 3 or 4 week period. I know some families are used to having day camp, being one day camp 1 week and another day camp another week, but we really encourage it to be a longer experience because the more the groups change, the more the opportunity there is for spread.
So we're coming up on 4:30. Can we keep you for about 10 more minutes?
Sure.
Will you give us another 10 minutes? That will allow us to get through all these questions, which I think people will very much appreciate. So why can't we have small gatherings of 10 or less when other parts of the state allow it?
That is something that the health officers across the Bay Area are discussing, and that's another step towards opening up our society. The initial shelter-in-place orders were really asking people to not mix outside of their household, but we realize how difficult it is, and how hard that is. The need for social contact, and doing it virtually only goes so far, and it's not the same as being in the same space. And so we're looking at ways to build into future orders the possibility for small groups to get together, small stable groups outside of the household. It's not currently allowed now, but we're looking at that for the future.
When will schools go back to normal?
So the state is actually currently working on some guidelines for schools, and they've been working very closely with our school leaders, our school superintendents. The health officers have also been working very closely with our schools, and so we're really hopefully going to have some more clear guidance about school activities, not only for the summer, but hopefully to help us get some planning for the fall. Virtual learning is challenging. It's really hard. It's hard on the teachers. It's hard on the students, and it's hard on the parents who are trying to adjust to their children learning virtually. So those guidelines are coming, and we'll hopefully have some more details very soon.
So this is an important one. High school football. Is it going to happen?
That's a really challenging one because obviously football is very much a contact sport. It involves a large number of players. You can't social distance and play tackle football. So those are very challenging things. We're looking at professional sports now, trying to figure out how to do this, safely, and how to put on professional sporting events, maybe without crowds in the stadium, and how to do that safely. So we're probably going to be learning a lot from the professionals on how they do that, and maybe take some of those lessons learned and apply it to high school sports and other contact sports. But contact sports, especially among large groups like a football team, it is a very high risk activity. So we have to think through that really carefully.
Doubles tennis is another question you've addressed before, but we got that question again. Can people play doubles tennis?
Not at this time. So the outdoor activities that we're allowing are based on the concept of activities that are not contact sports that you can social distance with, that you're not using a lot of shared equipment. So you can play singles tennis, maybe you have two different colored balls and one person touch one ball, the other person touch the other ball. But doubles tennis, when there's two people on the same side of the court, it's hard to stay 6 feet apart and still have a competitive game. So we're really working on those concepts of activities you can do and maintain that social distance and not touch a lot of shared equipment.
What about churches? That's obviously one we're hearing a lot about.
Yeah, and the state just came out with guidelines around churches. Just came out with that within the last couple of days, and so we in the Bay Area are really looking at those guidelines and studying those guidelines, and thinking about at what point we can allow some more church activities. Right now, a lot of churches are meeting virtually on Zoom or other platforms. We did put out a couple of weeks ago a vehicle-based gathering ordinance that would allow some churches and other groups to gather in their vehicles. But we realize that's not the same as getting together um, uh, in a church building, or even gathering together outside of your vehicles, but in the outside fresh air for a church gathering. So we're going to be looking at that. It's not currently allowed by the local borders, but we do realize the desire for a lot of people to gather. Churches, unfortunately, have been sites of a lot of outbreaks in California and throughout the country. So we have to do this carefully and thoughtfully, because we don't want our churches to be places where people get sick and spread the virus. We want to do it in a safe manner.
So I want to remind everybody watching that our website at cchelp.org has an extensive FAQ list that really delineates what activities are or are not allowed. So if we didn't get to your specific activity today, I really want to encourage you to visit cchelp.org and look for information there about specific activities. There are a couple of other questions on here that I think are really worth spending a little time on. So we got the question, if there is a resurgence of cases by September, how quickly will you require non-essential businesses to close again?
It's a good question, and it's something we don't have a defined answer on yet. We know that the action we took quickly in March made a real difference in places that didn't shut down as quickly. They saw tremendous surges. The fact that we shut down, right before St. Patrick's Day, when a lot of people are used to going out and socializing, may have made a big difference. Places like New York that took another whole week to shut down saw tremendous surges. So we know sometimes if there is a surge, acting quickly can make a difference. What we don't know is all these different social distancing protocols that we're putting in, how much they are slowing the spread. And so we're hopeful that if we do see a surge, it'll happen at a slower pace, because we are practicing all these different social distancing and infection control techniques that we're just not used to before COVID came around. We weren't used to wearing face coverings in public everywhere we go. We were not used to staying 6 feet apart from people outside of our household. So we hope those things will make whatever surge happens come very slowly, so we can react to it in a measured pace. But the thing about epidemics is they tend to spread in an exponential fashion. And so when the cases go down, they go down exponentially, and when they go up, they tend to go up exponentially. And we've seen that certainly throughout the world, that small numbers can quickly turn into big numbers. So that's why we watch the numbers every day and really are prepared to take action if we see the numbers heading in the wrong direction.
So there was a report on local media late last week about a doctor in our community who works at a local trauma center, reporting that there was an increased number of suicides and severe suicide attempts coming in through their trauma center since the shelter at home began. From a public health standpoint, doesn't that mean we should be focusing more on mental health aspects of shelter in place?
We definitely should be looking at the impacts of shelter in place on mental health. We have not seen a rise in suicide attempts, and we're having our behavioral health division look carefully at all the data to see if there's any kind of increase in suicide attempts or other kind of concerning trends throughout the county. We don't have any data to show that at this point, but it's something we're really concerned about. We're really looking at carefully. We know that it's been hard on a lot of people. We know that the economic downturn has led to a lot of people to lose their jobs, lose their income. That's an incredible stress that is placed on families, and we know that's been really hard on people. And people are missing a lot of those important social connections that are really important for their mental well-being. So we're really looking at all those things, and that's why we want to open up the society. We want to open up the economy, but we also want to do it carefully and safely because we also want to protect lives, and we don't want to trigger a surge that's going to lead to another shutdown.
So we want to remind everybody that 211 is a really great resource for anybody who feels like they need help. They can connect you with all kind of resources that are out there. So we really encourage anybody who might be having any thoughts or any struggles to call 911 or to call 211. They can help put you in touch with whatever resources you need. The other side of it is the unintended health issues that come from being sheltered in place. People might not be seeking care for heart attacks, drug overdoses, suicides. Are we tracking these?
Yeah, we are. We are looking at those. We're looking at our ambulance volumes. We're looking at our hospital volumes. We're looking at, quality outcomes as far as, people getting their mammograms, kids coming in for their immunizations. There is, some reports showing that across California, a lot of kids have taken a pause on getting some of their vaccinations and delayed getting some of their vaccinations for a lot of those childhood illnesses, and so that's a concern. And initially when the outbreak really began and we began the shelter in place, a lot of hospitals and medical clinics stopped doing routine care or moved to virtual care because they didn't have enough personal protective equipment, and they needed to be prepared for a potential surge that was very likely heading our way at that point. Now that we've been able to flatten the curve and we've been able to improve our mask and gown and glove supply, and we are now seeing those facilities open up, reach out to their patients, encourage patients to come back for their routine health care, encourage kids to come in for their vaccinations, the women to come in for their pap smears and mammograms, people to come in for their blood pressure checks and diabetes checks, all that kind of routine care. We don't want people to put that off for too long. Hospitals and medical clinics and doctors' offices have also really transformed how they operate. So they're screening people when they arrive. They've got extra hand sanitizer stations. They've got waiting rooms where people are spaced 6 feet apart. Some offices have people wait in their cars until their appointment time, and then they're called in from their cars, so they don't even have to stay in the waiting room. So our medical and dental clinics and hospitals have really transformed themselves to make them safe places for people to come get care during this pandemic. And so really encourage people to get your needed medical care and don't put things off any longer.
So I think people are wanting more detailed information about the suicide indicators that we talked about. So I will say that we have a graph that we got from the coroner's office that tracks suicides for the past 12 months, and we will post that in the comments here when this is done. We can sort of see one suicide is one suicide too many. Every one of us thinks that, but the trend I think is obvious in the graph that we're happy to provide. And then as we're able to sort of collect more information about what the doctor in the community was talking about, we'll make that available to the public as well. Because I think again, all of us feel the weight of it, but it's something that we're looking at closely, and I think that's information worth sharing. So we'll come back to everybody with that information. That's really all of the major kind of categories of questions that we got today. So I thank you for taking even more than the half an hour you had allotted to us to be here today, Dr. Farnitano. Wanted to remind everybody as well that the video will be here on Facebook for you to watch anytime or as many times as you like. And then we will find some time with Dr. Farnitano to do this again next week. So we thank you for your comments and your questions, and we appreciate you participating, and we will see you again next week.
Thank you very much.